a discogram and steps associated with it. I use double Siam technique, and as you see, in synchrony, I get X-rays. We start the surgery around 7:45. Here in AP, I adjust the films and we need to make some marking on the skin after I get the proper. I put a needle that is bent, the tip is bent, and by changing the direction of the needle, I get inside of the disc. Patient is on MAC, so we have to be very efficient here. The first needle in the 4-5 is placed as you see, and then I reposition for 3-4 and 2-3. And here we see the needle as well in the next level going up. And this process, as you see, we started 7:45. Already 10 minutes later, 2 of the needles are placed. And as you see, skin marking for the third level, and the needle is placed in that level. A little air sucked in, as you see here. Now we are able to pressurize the first disc. Patient reports 10 of 10 concordant pain. In the next level, as you see, there is insufficiency, but good part of the contrast stays inside. Patients report pain, which is not quite concordant. It's 6 and 7 of 10. And in the 2-3, which is a control level, you see practically a normal disc developing, and patient has no additional pain. Now, post-discogram, we always get a CT to visualize the associated morphology in the CT, in the AP view, and here I get the coronal view as well here visualized. So let's get to the midline first. As you see, practically this 2-3 has a normal disc morphology. 3-4 as well has quite normal morphology, but there is some leak. But in the 4-5, practically this disc is very insufficient. Contrast is extruding. Again, let's look at the same pictures in the coronal. Here again, you see that normal disc morphology, some pathology, and practically a pathologic circumference of disc insufficiency. Here again in the axial, you see a normal disc. More or less, we came from the left side. Some of the leakage might be related to our own needle that we put in, and contrast may be extruding from that. And then next level, as you see, there is a disc prolapse and disc insufficiency that is here, but the center of the disc is well visualized. Patient did have a pain, but this pain was not concordant, meaning not usual pain. And the next level, practically there is a complete insufficiency of the disc, and it contrast goes all around. And certainly this is a positive discogram for L4-5. We often use the discogram to reduce the number of the levels that need management. Just for reference, I'm going to show you the MRI of this patient. And here, patient has as well, you see, disc insufficiency in 4-5. In 3-4, there is some finding, but discogram could rule out that 3-4 is contributing in any significant way to patient's clinical symptoms. Thank you.